So if you've been following me, then you know that I love women's health and I love Chinese medicine. And I love using Chinese medicine to help women's health. And what I want to share with you is what I've discovered in my journey is how unbelievably powerful Chinese medicine is in general. But the longer I'm practicing, I'm discovering how unbelievably powerful Chinese medicine is specifically for women's health. So I want to share with you some success stories from my clinic that can demonstrate to you how great, powerful, and effective Chinese medicine is. So I wanted to say hi to everybody who joined. Thank you so much. And wait, I'm going to tap on the wave there. I waved to somebody. Okay, so I want to share with you 3 success stories from my clinic. And I think they really give you a good sense of different ways that Chinese medicine can be helpful when it comes to women's health. So the first case I want to share with you is a case about Leora. Leora was a 25-year-old, at the time that she came to me, was a 25-year-old student. And she'd been trying to get pregnant for 2 years. And what she had was diagnosed as unexplained infertility. What unexplained infertility means is that she went to a doctor and the doctor did a full workup and couldn't find really any reason why she and her husband were not achieving pregnancy, meaning the sperm count was fine and she was ovulating every month. So they couldn't really see her, and everything was open, her tubes were patent, and they couldn't find a reason why she wasn't getting pregnant. So that's a diagnosis of unexplained infertility. Now the truth is, 2 months before she came to me, she did get pregnant and then had a miscarriage. And she decided after that she wanted to try Chinese medicine. So when she came to me, I did a full intake and discovered, yes, that her cycles were normal and she had regular ovulation, but every period really, really hurt. Cramping was really severe. And in Chinese medicine, that's a really important clue as to helping diagnose why someone's not getting pregnant. Because when we're trying to get pregnant, we want to make sure that everything about your period is perfect. Meaning that you get a period, that your ovulation is at the middle of the month, that you have the right number of days before ovulation, the right number of days after ovulation, and that when your period comes, it comes easily with no spotting beforehand. It's pain-free and lasts for around 4 to 5 days. So she did have regular periods and they lasted for 4 to 5 days, but the first day or two were very, very, very painful. So that was already the first red flag and helped me to figure out a Chinese medicine diagnosis. She also told me that she was suffering from anxiety and her hands were very, very sweaty. So again, when I treat with Chinese medicine, we don't only focus on the one problem at hand, but we try to really focus on the whole person, the whole body, and to heal everything at the same time. So, you know, there isn't a blood test that can tell me, oh, now she's fertile, right? Especially if it's unexplained infertility. But what I can do is look for the clues of what is out of balance. And as those things come into balance, then we get a sense of her fertility improving. So her first period, which was about 3 or 4 weeks after we started treatment, was much less cramping than she was used to, and she said she only had to take 1 Acamol, so that was already a good sign. And she also said that she was noticing that she had less anxiety than she'd had before, which is also a really good sign. So that month she did not get pregnant, and then she went on, she had gotten her period, and then the next month she once again charted, and she noticed that she ovulated, I think it was on day 18, and that her temperature went up after ovulation because I had her charting, and we know that the BBT temperature goes up after ovulation. And what's important to notice when you chart is that during the luteal phase, which means this phase after ovulation, that the temperature stays up. So her temperature stayed up, which was great. And then when she got to around the time where she should have gotten her period, she had what we call a triphasic shift, which means her temperature went up again. And that is a sign of, you guessed it, that she was pregnant. So basically, she became pregnant in the second cycle of us working together, which is awesome. And we continued treating her because she'd had that miscarriage. We continued doing acupuncture, which was awesome because she also was nauseous. So the acupuncture was helping to solidify the pregnancy and make sure her body could hold the pregnancy. And we worked on treating the nausea. And she, after 9 months, delivered a healthy baby boy, Baruch Hashem. And what was great about this case was that not only did she get get the pregnancy that she wanted, but she also had less cramping on her period, and she also felt much calmer and less anxious. So it was just great all around. And of course, now she has a little baby boy. So that's awesome. So that's my first case about Leora that I wanted to share with you. And I want to share 2 other shorter cases. The first one is Noah. Noah is a 45-year-old woman, and I believe she's a teacher. And she noticed that her period was getting closer and closer together. And by the time she came to me, she told me that she was having her period every 14 to 21 days, which, as you know, is much too close together, right? A period is supposed to be around 28 days. It could be 25 to 32 days, but her period was 14 to 21 days, which is way too close, especially if you're Shomer Halacha. Hi to Chai Reflectology, who just joined. Chedva, nice to see you. Anyway, so she was getting her period way too frequently, and she was bleeding for up to 10 days. So you guys can do the math, but if you have a 10-day period and you're getting your period every 14 to 21 days, you can understand that it's really, really not tenable, especially as a firm woman. So we started to work together, and I gave her some herbs, and we started with acupuncture. And basically from that period that she had started, that she came to me when she had her period, and from then she basically did not bleed again until 28 days later. She got her period, and then continued on the herbs, continued on the acupuncture, and her period was regulated to 28 days. So that's a great, great case where it was really simple acupuncture. We only worked together maybe 3 or 4 times. We did it every other week, and we gave her the herbs, and she took the herbs. Sometimes she forgot to take the herbs, but she mostly tried to remember to take the herbs. But such a great result. From getting her period every 14 to 21 days, she went back to her 28-day cycle. So acupuncture was great for this perimenopausal bleeding. And the last case I want to share with you is a case that I just had in my clinic a few weeks ago, a case of Talia. She was 37 weeks pregnant with her second pregnancy, second child. And she actually came to me because she had such bad coughing post-COVID that she, all the muscles of her chest and her ribs were tight, and she didn't want to go into labor with those tight muscles. So I did acupuncture to relieve those tight muscles, and after the second treatment, she felt much better. But when she came to me, she also reported that she had what's called symphysiolysis, or pelvic girdle pain, which meant that she had pain in her groin and in her lower back, pregnancy-related pain in her groin and lower back. And I worked on that as well. So I not only released the pain in her chest, but I also released the pain in her pelvis. And then, like a few weeks later, she came back to me to do pre-birth acupuncture, and I did a treatment on her to get her ready for the birth. And she was supposed to come to me last Sunday in Yerushalayim, but she texted me Saturday night to tell me that she'd had her baby on Shabbat, which is great, Mazal Tov. And then she wrote to me Sunday night saying, I just want you to know how much the acupuncture helped me, that the pain that she had for sure in her ribs was better, but also the pain that she had in her pelvis was much better, and she was able to walk around without pain for 2 weeks, which is huge for a pregnant woman because the pain of the pelvic girdle pain is often from the weight of the uterus, and the fact that the acupuncture can really mitigate the pain even while a woman's pregnant is just amazing. In fact, there are studies that show that for pelvic girdle pain, acupuncture is actually even more effective than physical therapy. So anyway, the acupuncture was awesome to help her not only get rid of her chest pain, get rid of her pelvic pain, and help prepare her body for an awesome birth that came right on time. So anyway, those are my success stories I want to share with you today. Just to recap, we had Leora, the 25-year-old who had unexplained infertility for 2 years and a miscarriage, and she was pregnant within 2 months and delivered a baby 9 months later. We have Noah, who's a perimenopausal woman at age 45, who had bleeding every 14 to 21 days, and basically almost immediately, her period was lengthened to her normal 28 days. And then we have Talia, who was a pregnant woman who got relief from her pelvic girdle pain. So happy to share with you the awesomeness of Chinese medicine. It really is super amazing and powerful. And if you have any questions that are personal that you'd like to ask me, I'm happy for you to PM me at the end of the video. Thanks so much for joining. Bye.